You're listening to the Business Communicators.
Thursday, May 13th, the CDC announced that if you were vaccinated, fully vaccinated, you did not have to wear a mask anymore. Just days before, they were saying that you had to wear a mask if you were fully vaccinated, and they had just removed restrictions on wearing a mask outside. Now, while all three of us are fully vaccinated, I think that we've understood really over the last 5 months that there has been a lot of communication issues surrounding the COVID-19 pandemic, whether it's from the government to the public, whether it's from the media to the public, or even the CDC. And it's something that's not just unique to the United States. I mean, this is happening in Europe as well, especially with the vaccine rollout. And my take on this is that maybe it's causing too much confusion. And the lack of clear and consistent communications is maybe, pushing some people that are hesitant about getting this vaccine to the mindset of, hey, I'm not going to get this. Thomas, I'm going to start with you because you've got the background working in healthcare. What's your take on the the inconsistency from the CDC?
I don't think it's just the CDC. First off, we have to remember that the CDC is supposed to be an independent operations in the United States. So not determining who's the president, not determining what the political party, or not determining what the flavor of the month is. What they say should be what we should follow. But then also comes the fact is that with COVID this time last year, there were so many unknowns. The mortality rate, morbidity rate was super high. How do we treat someone here? How do we treat someone there? Do we need to wear masks? Do we not need to wear masks? Do we need to save the PPE for the things? So we need to be a little bit cognizant of the unknown and how things change. But with that being said, the CDC should also take ownership and responsibility to come out and say, look, there's a lot we don't know. These guidelines are protecting us right now. You can't go back and judge us what we said 6 months ago, a year ago, or whenever it was. And they have to say that this is how it's going through, and here's the research that comes from it. But then part of it also is the misinformation from social media and the news is because, one little segment of truth, and we've talked about that multiple times on this website or on this podcast about the changing of, well, I heard so-and-so did this, and so it doesn't matter to me. So they're wrong, so I'm going to start doing Facebook. So I think I think the CDC should be more concise in how they're precising their messaging and saying, look, we are learning as we go. Here are the guidelines as we know them right now. Here's the safety as we know them right now. And then to try to get a cadence, crisis management. We're going to talk every Monday or we're going to talk every Wednesday and not, hey, we're going to put out new stuff every 2 seconds.
I was thinking more in terms of how companies may approach this. I know the CDC, and they're saying, they're going to follow all these guidelines. I don't see companies jumping to change their protocols right away themselves or communicating different protocols. Just because the CDC is saying that. I agree that the CDC needs to have more of a cadence. And they also need to be more consistent in terms, but I think they don't know what they don't know until they know it. And that's why they're communicating the way that they are.
Agreed. And I think they should call it out as, hey, we're still learning as we go.
I don't think they're going to say that. But the woman, the CDC director, she has been very transparent, I believe. Much more transparent than other folks in the past who have been talking about this. So I give her credit where credit is due, and I give her the benefit of the doubt. As for coming up with a list of how, when, what, where, and whoever, if she is that person who is the spokesperson sharing this information on a regular basis or on a daily basis, whoever is working with her and whoever they're sharing this information with, they also need to be consistent in terms of what they're doing. And that's not what we're having right now. It's confusing because no one is consistent. I just say corporations need to stay the course on what their protocols are to create some stability and consistency for their employees who are coming to work until it is all figured out in more of a better flow or in terms of seamlessness with the CDC itself.
Yeah, I mean, but that's the problem. The CDC is not consistent, and the entire time businesses have said that they're going to follow guidelines of the CDC and government officials, and there's a lot of flip flopping going on. So now I think the CDC is putting, businesses in a tough spot. It's like, what do we do? Because our customers are saying, look, I'm vaccinated. I don't understand why I have to wear a mask anymore. I trust in the science of the vaccines. And then, but then they have other customers that are like, look, I'm only going to come if everyone's wearing a mask or everyone's vaccinated. So they're putting businesses in a tough spot, and I think that's going to be a challenge. But I think the problem with the CDC is I don't know that they've been fully transparent with all the information that they have. Because there's been a lot of inconsistencies and a lot of information that's come out over the last few weeks about them potentially being lobbied by the teachers unions when it comes to sending kids back to school, and maybe manipulating some of the data when it comes to transmission rates outdoors. That has been there's been scientific papers that have showed that for the last several months that transmission rates were essentially, I don't want to say zero, but pretty dang close to zero when it comes to outdoors and being, distance from people. And the CDC said that, as recently as 2 weeks ago, that number could have been as high as 10% for transmission rates. And so there's a gap somewhere. And I don't know where that gap's coming from. I don't know if it has to do with research, but I do find it absolutely fascinating. And just to go, peek behind the curtain, for IBC Houston, we're considering having in-person events soon. And I think the first one that we're considering having is potentially a happy hour in July. And this happy hour would be outside, let's call it, somewhere like Kirby Ice House or the Rustic, somewhere with an indoor-outdoor environment. And we sent a survey out to members of IABC Houston to gauge their thoughts on whether or not we should, if they'd be comfortable or not. And the feedback, I don't think it's going to be anything surprising. I mean, it was a mixed bag. You had folks say that they weren't comfortable going back in public until, COVID was eradicated. And then you had people saying, well, we should have never stopped in-person events. And then you had people suggesting that IBC Houston make sure that everyone's vaccinated that shows up to these events. And then you have people saying that, masks should be required, no food should be served. And so it's a tough spot. I mean, everyone's going to have a different opinion when it comes to COVID-19. And I think the problem is over the last year, we've been told, listen to the scientists, the experts, the CDC, Dr. Fauci, and the messaging has just been inconsistent. I think that's where people are kind of stepping back and saying, well, what is the truth?
Also, you got to think about a couple other things too. Even though the CDC has established this mandate, also remember that folks are following their local guidelines as well. And some local folks are doing things, they're being a little bit more prudent or stringent and still requiring masks everywhere just because the CDC says you don't. But that's been happening from day one. If you remember, CDC, here are your guidelines here, la la la. And then you have local guidelines that folks are also being asked to follow. And I noticed that local seems to be a little bit more conservative in terms of, well, not as conservative. They're very strong on still doing the mask in terms, because even when they came out with that.
Only in Harris County though. And so for context, we live in Harris County, or most of us. I don't know, Thomas, what county you're in.
I'm in Brazoria by about 10 feet.
Yeah. Okay. So in Harris County is like the only county in the state of Texas that is still at like level 4 or code red. And there's been a lot of pushback from both Republicans and Democrats, for Judge Hidalgo and her takes on that. But you go to any of these surrounding counties in the greater Houston area, you go to Montgomery County, you go to Fort Bend County, Brazoria County, Galveston County, it's definitely not as restrictive in terms of mask ordinances or mask policies. It's kind of interesting. I was in Nueces County last week in San Antonio, and I was a little shocked because we were at a restaurant for dinner, and none of the wait staff, none of the bartenders were wearing masks. And I was like, whoa, this is different. I'm not used to this. So I think that Houston in particular is a lot different than the rest of the state of Texas.
I was in Clearwater, Florida a week ago, and 2 weeks ago now, and the outdoor bars and things like that. And one of the things that we have to remember is we're talking to counties, we're talking to government. It's still up to your employer or the owner of the company to set those guidelines. And so it comes down to how much are they going to enforce? Because I remember going to like a beachside bar and grabbing a drink, and the person behind it was mad that they had to wear a mask even though she was vaccinated and everything. And it was because it was the policy of the company at the time. But come to the rescue of the CDC. They do a lot of really, really good research. I hope that they're not listening to the teachers' unions and other stuff like that. And you have to remember that while they are spending a lot of resources on COVID, they're also researching STDs and the flu and every other possible illness that can come through and how we can stay healthy. And so my hat tips off to some people I know at the CDC at what they're doing. Just let's get their communication efforts a little bit better.
Also, too, what we didn't mention is they're relaxing some of these mandates as well, too, because they're looking at it as an incentive for more people to get the vaccine. And I thought that was interesting.
Yeah, that's very true. Even when it comes to travel. I mean, you look at the European Union, they've announced that they're going to start allowing Americans to come into the EU sometime during the summer. They haven't been specific on when they're going to fully roll it out, but they've said they're going to allow Americans to come in only if they've got that CDC vaccine card. And I think that's interesting because I know there's a lot of people that want to travel abroad and they're not going to be able to if they don't have, that vaccine. I know someone who is wanting to go to Japan. Not me. I mean, I'm going, but I know someone that wants to go to Japan around the time that I'm going next year. And this person has no intent on getting a vaccine. And the person has already booked their flight, and I told them there's zero chance that you're getting into the country without a vaccine. Like, if you think the U.S. is restrictive, wait until you go to Japan, South Korea, Taiwan, Singapore. It's a completely different ballgame.
Yeah, and various industries are asking folks because as part of my travel, you have the cruise industry. They're going to be requiring up to 95% of their staff to be vaccinated, and up to 90% of travelers. Now that may change and go up. Hopefully it will. But who knows? It's just interesting how the industries are changing because they want to get back out there and get the economy moving again. And people are going stir crazy and they're ready to go on vacation and do things.
It's interesting you say the cruise industry because I think last week or 2 weeks ago, one of the cruise lines said, we're not going to go to a state unless we can ask to see vaccine records. And it's a major destination that for cruise ports. And they're straight up saying, we will take the loss of not having it because we want our ships to be safe. So I applaud any company that's going to take a stand and say, this is what we're going to do and not change the rules as they feel fit.
I agree.
Yeah, it's
because you also got to remember a cruise ship is a confined space.
And that was one of the starts of it. Like I think when they were saying about the mortality rate, it was like here's this country, here's this cruise ship was like number 3 for like the first 6 weeks of COVID.
Yeah, that was pretty wild. I mean, because that's the thing. It's a petri dish. I mean, you're just packed in there like sardines, and viruses can spread in an instant. And I mean, even prior to COVID, that was the case. I think there was like the norovirus that spreads often on cruises. But it's going to be interesting to follow what the guidance is, especially as more and more people get vaccinated. But I think the takeaway for me is that, COVID-19 is not over. I mean, we look at the numbers in India right now, and they're absolutely devastating. We are very fortunate here in the U.S. to be able to have access to vaccines. And we are very thankful for that. Even in Europe, even in most of the first world right now, they don't have easy access to vaccines. And they're not expected to get access to vaccines on a more broader level until the end of this year at the earliest. So we are far from through with this. We are just very fortunate that we happen to live in a country by just pure luck that we were able to get a vaccine.
You've been listening to the Business Communicators.